Hey, so I did a video a couple of weeks ago on aging in America and how fast we're aging and how that the poverty in America is going to grow with the aging population. So we're going to talk a little bit about some solutions, if there's solutions. But after working hard your whole life and you've put into the Social Security, um, you may or may not have any savings, but a lot of people are just over the poverty line and they can't afford um, long-term care. They can't afford to keep food on the table, pay the bills. So what are we going to do about that? So you'll have to excuse me too today. I've got a lot of notes with, yes, I know a lot of this information myself, but I'm going to have to kind of just make sure I'm covering everything as we go along. So that being said, first of all, most people know what Medicare is. Okay, and Medicare, dadgummit, my papers are all over the place. Well, I've seen people who have their cats climb all over the place, so I guess it's okay if my papers are going everywhere. Oh my goodness. Okay, so anyway, we've got Medicare, and it covers. It said 25% of Medicare enrollees have annual incomes below $21,000, and half of them have incomes under $36,000. I can't even walk in the grocery store today for less than $100 and buy anything at all. So it's mind-boggling how anybody that's making that a little bit amount of money is surviving. Okay? Hopefully your house is paid for or something. So you've got Part A and B and C and D, and it's so confusing. So first, A and B together are your original Medicaid, and they all have premiums. Even though they pay for stuff, there's significant out-of-pocket costs to all of these. They don't cover dental, vision, or hearing aids. You don't have that because there's so many gaps, so a lot of people have to get either Medicaid or private insurance or the Medicare gap insurance. It's just on and on and on. But Part A of Medicare is covering your hospital stay. Part B covers physician and other outpatient services. Part C is Medicare Advantage, which delivers Part A, B, and sometimes D through private health plans. This can get very confusing, and maybe we'll break it down later. Sometimes it's beneficial to have the original Medicaid, like if you're going to be in a nursing home, and sometimes it is not. Part D is the prescription drug coverage. Okay, so you've got Medicare that hopefully everybody over 65 has. Medicaid is of course, it's a state-funded program from the federal government. Every state has some form of Medicaid. Some are better than others. So you're looking at over 7 million Americans that are 65 and older that are on Medicaid. Now, this is where I'm just going to say to get qualified for Medicaid is becoming harder and harder. Okay, you have to be disabled, you have to be older, you have to be, all these things. You have to jump through the hoops, and I know it's getting harder to get Medicaid. Now, you can be both. You can have Medicaid and Medicare, and there's like 7 million adults that are dual eligible, and so in that case, that's a good thing. The only thing, so Medicaid, if you can't have over $2,000 in your checking account. Even by $1, then you're going to lose your benefits. $3,000 if you're a couple. So like if you go into a nursing home, which we've discussed before, and you have a home that's in your name, you have to sell that home and use all the money to pay for your stay before you can get qualified for Medicaid. So you may want to talk to a lawyer. Most of them are free just to talk, but I am going to tell you, you have 5 years to put your house in somebody else's name so that you don't lose it if you do have to go into long-term care. I'm hoping they change the rules for all this because it's. And I just had read that it's been 40 years or more since they've even updated any of the rules for Medicaid. So that's definitely an issue. Medicaid also provides, okay, these home services. Now, this, um, I've seen it work and I've seen it not work. You can tell me down below if you've had any issues with this. They offer personal care services, which include bathing and eating and personal services like meal preparation and cleaning your house so that you can stay in your own home. To and from medical appointments, which, if you're on Medicaid, um, they've got a free transportation line that you can go to all your medical appointments. Anyway, that is for sure. But it says almost half of older adults living in the community need support to stay in their own homes. So, I mean, if you've lived in your home for all these years, and it requires, homes, like everything, require upkeep. And a lot of people's homes are falling down around them. They're not getting any assistance with anything, whether it be bugs or lawn care or, paying the bills. I don't know. It's just a lot, and everybody would want to stay in their own home. Social Security benefits. I've been saying this for years because I just turned 60 in February, and I don't know that Social Security will be around when I need it. I've said it for years, and I still believe it. I think on the front of Life magazine or something several years ago, it said that Social Security would run out by 2025, or 2030 or whatever. And I'm like, yep, that's exactly right. So, you put in all your life, you work, and you not going to get it back. But anyway, without Social Security, and I thought this was very interesting, 40% of older Americans, 40% of older Americans would be below the poverty level without their Social Security check. So almost half. The average check is $1,900 a month. And that's the national average. So you've got some making way less than that. Depends on what you did and how much you made, et cetera, et cetera. So that's definitely, it's $22,000 a year. Back in the day, you could live on $22,000 a year. You surely can't now. So you've got SSI and SSDI, for people who didn't work that much. And it said, women make up the majority of SSI, people that get SSI because they took time off to take care of families, or they worked low wage or part-time jobs, so they didn't receive Social Security. So then they have to try to get SSI. And those are a lot lower checks. Okay, I'm trying to, just so you can try to put some of this together. Now, housing support if you're over 65. Okay? If you are in a place where you don't have secure housing. Hopefully you've paid for your house and you've got a safe place to live the rest of your life. If you do not, there are options, and we talked about these a little bit before. First of all, we have the Housing Choice Voucher, which helps. I thought, this is interesting. So they want people to stay in their own home, but this pays, you only have to pay a set portion of your income, and the voucher will pay the remaining difference, okay? It's the largest federal rental assistance program and supports more than 800,000 older adults. That may be something you're interested in. Public housing, of course, is always an option. Like I said before, in New Orleans, there's all kinds of them, but they all have a big 5 or more year wait list. Plus, they haven't been updated since they were built in the 60s. So I don't know how great that is where you live. Some public housing has been updated. A lot of in general public housing in New Orleans, because of Katrina, they were all rebuilt. But like the amount, the ones that are based on your income, and your age or your disability, like I said, those have the long wait list. Um, Section 202 supportive housing is just for seniors age 62 and older. And let me see, it said those who had this 202 supportive senior housing had an income of just over $15,000. Okay, so there's that to help. You can look into that. And there's also the HUD homeless assistance program. If you look like you're going to be homeless, you can get a hold of them and they will help you with housing. Okay. They also have a low income home energy program where they help with your electric bills, and nutrition assistance. So SNAP benefits, definitely need to apply for food stamps. And then if you're older, there's always the Meals on Wheels, which, that's been going a long time, and they bring you healthy meals to your home. I think just once a week. I'm not really sure. So you've got some form of food. Now, my job that I have now, which is not in a nursing home, I just, since June, and I work with a lot of Medicaid patients. These are not older, these are just Medicaid. So what I'm seeing, though, is a lot of the food banks are running out of food because of lack of donations. I've been trying to call churches, see if they will help sponsor some of families in their area that don't have food. I mean, because even though people are getting food stamps, they've been cut back, so they don't get a lot of food stamps. Now, I'm also all about people helping themselves, pulling yourself up, and trying to figure out how you can make it work for you. Don't just take handouts, okay? Because believe me, the handouts they are going to stop. This is not like everybody's just going to get everything handed to them all the time. I mean, food is drying up. Like the place close by here, people are standing in line for 2 blocks 3 times a week to get food, and all they're getting when they get up there is a handful of grapes and peaches because there's no food. So there's got to be other options. Just tell me down below where you are and what you need, and if you have any ideas. I know in the Bible it talks about, helping others that are less fortunate than ourselves. And so, we can do that. I'm not of the mindset that everybody that is wealthy is supposed to give all their stuff to the poor people. And so, the poor people, and they don't have, so we all need to be equal. That's socialism. And I'm not a socialist. So I'm just saying we need to help each other, especially in these hard times, lift each other up, but also, just find ways to help yourself if you can. But we are getting old fast, and none of us plan for it really. I mean, it just happens. One day you're 60. How in the world did that happen? I still feel 40. So, anyway, I'm anxious for this community to get built up so that we can help each other. It may be all that we have coming soon. So thanks for listening.